and in succession to the videos what I have been taking up in pediatric dentistry. So today's video I'll be mainly focusing upon as to what is the role of euphemism, which is also called as the use of second language in pediatric dentistry. So students and viewers, do remember, the child should always be communicated at the level of his or her own understanding. So whenever the pediatric dental patient or the child patient is entering the pediatric dental clinic, it is very, very important that the healthcare personnel, the dental personnel, the receptionists, as well as the assistants, even the assistants and the pediatric dentist should be using such terminologies, such words which are to the level of the child's comprehension. So whatever the child's vocabulary is there, the child's comprehension is there, the children should always be made to understand in such a way to the level of their comprehension. So very, very important. It is very important, and sometimes this has not to be confused. A 3-year-old child who is a preschooler, he has a different sense of maturity, a different sense of vocabulary, and his level of comprehension will be entirely different than an 8-year-old child. And when a preschool child is coming, so in such a case, if I am going to inject some local anesthesia, or so just it can be said that I'm going to spray a sleepy water on your tooth rather than saying I'm going to give you a shot on the gums. So this will be quite offensive if I use such words. So being a pediatric dentist is quite challenging, and it is very, very important to alter the tone and the volume of the voice. A kind, firm, honest and a loud voice says it all. It is very, very important that it is not that important to say that what we are saying, but it is very, very important that how we are saying a particular thing. So it is very, very important that a 3-year-old child who is a preschooler, he should be talked, he should be communicated in such a way to the level of his or her own understanding. He should be tried to make comfortable just by using the such terminologies which the child is already acquainted to. Apart from this, if an 8-year-old child is being, such a grown-up child is being treated like a small child, and such terminologies what are being used to him, which is quite, so the child might feel that it is like, the child may perceive that it is like talking down to the child. So very, very important. So most important, the use of second language, which has also been called as euphemism. This is having, in dental terminology, there are certain different words for the dentist. The pediatric dentist can use such words to make the pediatric dental patient more cooperative and comfortable and used to the environment. So most important thing, if it is a 3-way syringe and you're going to blow air, so air can be said, the word substitute for air is wind. If I'm going to place a band in the tooth, so it can be said that we are going to place a ring for the tooth. If a stainless steel crown is to be given to the pediatric dental patient, so this can be said to the child's comprehension that the tooth is going to have a hat. So if I'm going to inject local anesthesia to the child, so this can be said as, just as in a simple way, that I'm going to give sleepy water to your tooth. For impression taking, if you are using those impression materials, anything, so this can be simply said, just I'm going to put some certain mashed potatoes in your mouth. Apart from this, there are certain other things. For example, an X-ray machine can be said like a camera. The radiograph, what is being taken, can be said to be a tooth picture, whereas an handpiece can be called as a whistling Charlie. So this is a very important, very frequently asked question in the professional exams for the dental students, that in a pediatric dental clinic, the child should be communicated to the level of his or her own comprehension, to the level of his or her own understanding. So students and viewers who are new to my channel, who haven't subscribed, subscribe, and if you like this video, give this video a thumbs up. Those who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.